Thank you all for joining. Am I good to get started?
Yes, please start.
Perfect. Hello everybody. My name is Mehmet, and I'm a member of the American Lung Cancer Screening Initiative, ALSI for short. Today we will be giving a presentation on lung cancer and lung cancer screening. We are grateful for the opportunity to present to you. Before we get started, I'd like to request that everyone is muted during the presentation. However, we would love to take any questions at the end of the presentation, so please feel free to put your questions in the chat box, and then I will address them at the end. Before we get into the presentation, I want to share a little bit about what ALSI does. We are a 501(c)(3) nonprofit that works to raise awareness for lung cancer screening. We're a team of over 200 passionate students and doctors located across the United States. At the national level, we've worked with community organizations like the South Asian Network and American Indian Cancer Foundation, as well as city and state health departments, including the NYC and Connecticut health departments. We hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. Today, we will discuss both lung cancer and lung cancer screening, addressing questions such as how common is lung cancer, what is lung cancer screening, and how do you get screened? First, we will talk about some major statistics around lung cancer. Lung cancer is very common. It's the second most common cancer in the US, excluding skin cancer. This graph shows the American Cancer Society estimates for the number of new cancer cases in 2022 for the four most common cancers. As you can see, it is estimated that 236,740 people will be diagnosed with lung cancer in 2022 in the US. And I know this is a little bit outdated, but the statistics are, around, similar numbers for now. And to put this number into perspective, it's estimated that about 6% of people develop lung cancer in their lifetime in the United States, which means 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. So it is certainly not a rare, disease. It can happen to any of us. And not only is lung cancer very common, but it is also very fatal. Lung cancer is the leading cause of cancer-related death in the US and the world, like the number one cause. And so in 2022, it is estimated that lung cancer will claim the lives of 130,180 people. This graph shows the American Cancer Society estimates for the number of cancer-related deaths in the United States. And so as you can see, lung cancer is actually far more fatal than breast, prostate, and colon cancer, which are also really commonly talked about. And this causes more deaths than all three combined. And lung cancer makes up a quarter of all cancer deaths, resulting in about 350 deaths per day. Every year, there are about 50,000 more cases of breast cancer, but lung cancer causes over 90,000 more deaths. And so from this data, the question comes, why is lung cancer mortality so high? Lung cancer mortality is so high because patients are typically diagnosed at a later stage. We can't detect it early enough. And so as you can see, nearly 50% of lung cancers are diagnosed at a distant stage where the 5-year survival rate is only 6.7%, which is really, really low. And so stage is a way for doctors to classify a cancerous tumor based on tumor size. If the cancer is spread to lymph nodes and if the cancer is spread to other locations in the patient's body. And so why is stage important? It's important because the stage that your lung cancer is diagnosed correlates directly with your survival rate. So when lung cancer is diagnosed at a late stage, the 5-year survival rate, as you can see, is 6.7%, but in other, stages, it's much higher. So one way that doctors track the survival of patients is by looking at the 5-year survival. And so the 5-year survival for patients with localized or early cancer is 57%, which is decent, but only 25% of lung cancers are actually diagnosed at that stage. In comparison, nearly half of lung cancers are diagnosed at a distant or late stage, which has far fewer, survival rates. And this is why early detection of lung cancer is so important. If you can detect lung cancer at an early stage, then treatment options are better and prognosis is better. With lung cancer being such a morbid disease, some of you might be wondering, Why the majority of lung cancers are diagnosed at a later stage? What can we do about that? And so the majority of patients are diagnosed at a late stage because they don't start feeling any of the symptoms. They don't feel anything is wrong with them, and so they don't need to go to the doctor. Why would you if you don't feel there's anything wrong with you? But you could actually have lung cancer and it can be spreading, even though you might not have any symptoms, which is why people never catch it. So the most common symptoms that you might be observing are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing. So a lot of breathing problems could be related to lung cancer because it is a respiratory disease. However, when people become symptomatic, the cancer has already usually grown and spread to a point where it is more difficult to treat and prognosis is poor. If the diagnosis of lung cancer has to wait until the patient has symptoms, it is difficult to catch lung cancer early. So the question we ask is, how do we catch lung cancer early if patients are asymptomatic or don't have any symptoms? That's the key. One of the best ways that we can do this is through lung cancer screening. Lung cancer screening is done through something we call the low dose computed tomography scan. If you are eligible for lung cancer screening, it is recommended that you get an annual lung cancer screening, and so once a year. In the coming slides, we will discuss what lung cancer screening is, who should get screened, and how to get screened. So basically, everything you need to know about getting yourself screened if you or a loved one of yours would want that. An important distinction we want to make is that lung cancer screening is done using low-dose computed tomography and not the chest X-ray. So we aren't using chest X-rays. We use low-dose CT scans because it provides more detailed pictures than chest X-rays and is better finding small abnormal areas in the lungs. The image on the left is a chest X-ray, and the image on the right is a picture of a low-dose CT scan of the chest. As you can see, the low-dose CT scan is more detailed than the chest X-ray and better allows us to see anything abnormal in the lung. The question that researchers wanted to answer is, how effective is the low-dose CT scan at detecting lung cancers at an early stage? An important lung cancer screening trial called the National Lung Screening Trial, or NLST, tried to answer this question. The low-dose CT scan caught more lung cancers at an early stage. These cancers were more likely to be treatable, and the prognosis was much better. This translate to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to an X-ray. So this technology is essentially more effective at catching this earlier. A concern with any screening test is accuracy. Essentially, how good is the low-dose CT scan at catching lung cancer? For every 100 individuals undergoing CT lung screening, 25 will be positive and 75 will be negative. Of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. This means that the test is very good at identifying people who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive, and the test will not miss your cancer. Out of the 25 individuals who are positive for lung cancer, 23 turn out to be negative for cancer, primarily with follow-up imaging done. This means that even if your test result is a false positive, it's really easy to rule out cancer using further non-invasive imaging. And as you can obviously tell, having a false positive is less threatening than a false negative because false positives are just extra precaution. The two individuals that have a positive test result and truly do not have lung cancer or more likely, so that's these people here, more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening, which means that their treatment and prognosis is much better. The results of the NLST were published in 2011, 11 years ago, so this is from a while back, but several studies have been published since then, further confirming the life-saving benefit of lung cancer screening to high-risk populations. Lung cancer screening significantly reduces lung cancer mortality, but who should get screened for lung cancer? The U.S. Preventative Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 50 to 80 who have a 20-pack year smoking history or greater and who are current or former smokers who quit within the past 15 years get annual low-dose CT scans. The current screening guidelines require you to have a 20-pack year smoking history. And so pack year is probably a term that most of you haven't heard of before, but it's a way for doctors to track your smoking history over a period of time. And a pack year is defined as smoking a pack of cigarettes per day for a year. So if you were to smoke one pack a day for 20 years, that would equate to a 20-pack year smoking history. Alternatively, if you smoke 2 packs a day for 10 years, that would equate to a 20-pack year smoking history, even though you did it in a shorter period of time. The important takeaway is that there are many different ways to reach a 20-pack year smoking, and the pack year is a way to help doctors track your smoking history. Here is another way to track smoking history by counting the number of cigarettes smoked per day rather than the packs of cigarettes. On average, each pack of cigarettes has about 20 cigarettes, so we can take the number of cigarettes smoked per day, divide by 20, and multiply by the years to smoke to calculate the pack year smoking history. So there's multiple strategies to calculate how much you were smoking. Um, if you are. If you're not, then that's good. But these new guidelines will nearly double the number of eligible individuals for lung cancer screening in the US. So we use that data to help determine if you were eligible to be screened. And so notably, the most apparent increases in eligibility will occur among women and minorities. However, while these new guidelines will include more high-risk individuals, they only include individuals with heavy smoking histories. There are other risk factors for lung cancer that are not accounted for in the current screening guidelines. After smoking, the next leading cause of lung cancer is exposure to radon gas, which is released from soil and can build up indoors. Moreover, the secondhand smoke causes almost 3% of new diagnoses of lung cancer and is expected to cause about 3% of deaths from it in 2022. Additional risk factors include exposure to asbestos, family history, COPD, and previous radiation therapy to the lungs. It's important that we recognize these additional risk factors because although lung cancer has a strong association with smoking, there are a large number of people in the US who have never smoked that still get lung cancer. Personally, my grandmother, contracted lung cancer and passed away from it, but she had never actually smoked a day in her life. We believe that it was due to radon poisoning, but the fact of the matter is that even if you don't smoke, you still could be at risk, and so everybody eligible should be getting screened. Lung cancers can occur in never smokers who are individuals who have smoked less than 100 cigarettes in their lifetime, which I know seems like a lot, but in the grand scheme of things, it isn't. Because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses and is the eighth leading cause of cancer-related deaths in the US and the world. More never smokers die from lung cancer each year, and people die from ovarian cancer. So this one subset of lung cancer diagnoses is greater than a lot of entire cancer diagnoses. This graph shows the proportion of lung cancer cases that occur in people who have smoked in their life and those who have never smoked. It is then further broken down by whether they are a current, former, or never smoker. As you can see, 80 to 90% of lung cancers occur in people who have never smoked in their lifetime, and about 10 to 20% occur in never smokers. Right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding lung cancer in never smokers is a current focus of research. With the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should be screened for lung cancer. Interestingly, women are more likely to be never smokers when diagnosed with lung cancer. In fact, in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. In summary, lung cancer is the leading cause of cancer-related death in the US. It is so deadly because most lung cancers are diagnosed at a late stage when they have spread to other locations in the body. Importantly, early detection through lung cancer screening by use of low-dose CT can reduce lung cancer mortality by up to 33%. This graph shows that national screening rates for some of the most common cancers, including breast, cervical, and colon cancers. The screening rates for these cancers average around 73%. I would like to ask everyone to guess what the screening rate for lung cancer is. So if we can just take a guess, maybe think in your head, if these cancers are at 70-ish percent, what is lung cancer screening rate? So we have one guess that says 20. If anybody else has a guess, you can put it in the chat. Okay. Uh, as you can see, the lung cancer screening rate is 5.7%. All four of these cancers have screening tests that are recommended by the USPSTF, but the uptake of lung cancer screening is much lower than the uptake of screening for other cancers. Um, the American Lung Cancer Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the US, we would save 48,000 lives. However, we are only screening 5.7%, which means that a lot of lives could be saved that are not being saved. But why is this the case? The lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening, cost of screening, and the safety of screening. In the next slides, we will all discuss each of these topics. The important takeaway, though, is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. The first potential concern we will address is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there are a few exceptions. Medicare will only cover lung cancer screening until the age of 77. Not all state Medicaid plans cover lung cancer screening, so check your state, and patients will still pay the usual fees for provider appointments before or after the scan. As I just mentioned, unfortunately, not all state Medicaid plans cover lung cancer screening. Here is a map updated in July 2022 showing which state Medicaid plans do and do not cover lung cancer screening. Dark purple states have state Medicaid plans that do cover lung cancer screening and use updated guidelines. So dark purple is they do cover. Purple states also have state Medicaid plans that cover lung cancer screening, but may be using older lung cancer screening guidelines. Blue states are not covered, Arkansas, Alabama, and Alaska. And in gray states, Hawaii, this particular information is not available. The first step to getting a patient screened for lung cancer is having them talk to their primary care provider. There are certain questions a primary care provider has to ask and topics that have to be discussed. One of these is the patient's past year smoking history, which we discussed earlier. Um, and so to find accredited lung cancer screening centers, patients can go to the American College of Radiology website. They can type in the state or city that they live in to see where accredited lung cancer screening facilities are located near them. The American College of Radiology website is listed in the middle left hand of the screen. You can go there to check it out. And we can also share these slides afterwards. And so this is the Stanford website, which you can also check out. As far as how the experience of getting a low-dose CT scan goes, it will require you to lay on your back for about 5 minutes. You'll be doing something very similar to the patient in the photo here. One thing to note is that this process will not hurt at all. And because this is a low-dose CT scan, you do not use contrast. This means that there will not be any needles or injections involved. The low-dose CT scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation exposure is very, very low. The way that doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. It is just a way to measure radiation and compare the levels of radiation received during different activities and over time. For a low-dose CT scan, you'll be exposed to 1.5 to 2 millisieverts of radiation. This is a lot lower than a full chest CT scan, which requires a radiation dose of 8. To put that in perspective, you are exposed to 3.11 millisieverts of radiation a year just from breathing, cosmic radiation, eating, and the radiation from Earth. So a low-dose CT scan exposes you to less radiation than you are exposed to just from existing on Earth, which means that the level of radiation you receive from an annual lung cancer screening test is very, very small. But that being said, there is always something that patients can discuss with their primary care provider if that is something that you're concerned about. But the benefits do outweigh the costs, which are basically none in terms of radiation. And so a patient talked with their primary care doctor. The PCP referred the patient to the screening center and they received a low-dose CT scan. What is next? The doctor will receive the results of the patient's screening test and will follow up with the patient to go over the results. As far as results go, there are three most likely outcomes. The first outcome is that the scans are normal. If this is the case, then the patient should look to get repeat scans in a year. If the scans are abnormal but probably benign, then the patient should talk to their doctor about the next steps, which may include more scans, tests, or biopsies. If the scans are abnormal or suspicious, then the patient will most likely have to undergo additional testing, such as a biopsy. So lung cancer screening, oops, I'm sorry. Lung cancer screening saves lives, but a question you might be wondering is, can individuals still get screened for lung cancer during the COVID-19 pandemic, and is it safe to do so? And so I just want to touch on this briefly, even though the pandemic is uh, mostly the things have returned to normal, but during the pandemic, the cancer screenings decreased significantly. But lung cancer won't stop because of the pandemic. If you are at high risk, still for developing lung cancer, you should get tested. And most hospitals do operate lung cancer screening programs in patients. You can wear a mask during the entire process, even when you're getting the scan. And if you follow precautions like wearing a mask, lung cancer screening during the pandemic or post-pandemic, it's safe. So don't feel deterred from that because again, the benefits do outweigh the costs. Oops. And so, as we mentioned earlier, um, while smoking is a risk factor for lung cancer, there are other risk factors as well. Radon is the second leading cause of lung cancer in the general population, the leading cause of lung cancer in individuals who do not smoke. Radon is responsible for about 21,000 lung cancer deaths every year. Radon is a radioactive gas released from normal decay of elements uranium, thorium, and radium in rocks and soil. Without special equipment, it's actually very, very difficult to detect. It's invisible, odorless, tasteless gas that seeps up through the ground and diffuses into the air. Radon is present in nearly all air, but at low levels. Only about 0.4 picocuries per liter of radon is normally found in the outside air. It is when the radon levels are high that individuals are at risk of developing lung cancer. Here's a map of radon zones from the U.S. Environmental Protection Agency, or EPA. Zone 1 indicates regions with radon levels greater than 4 picocuries per liter. Zone 2 indicates radon levels from 2 to 4 picocuries per liter. And Zone 3 indicates radon levels that are less than 2 picocuries per liter. However, the EPA recommends that all homes get tested for radon regardless of location. Um, and so the only way to truly know the radon levels of your individual home is by testing. Testing is easy and low cost. To test your home, you can pick up an at-home testing kit from a home improvement store or hire a radon measurement specialist. You can get an affordable kit from the hardware store or by calling 1-800-SOS-RADON or by going to the National Radon Program Services website, which is, I believe, linked, I think. The average cost for a test kit is between $10 to $30. The EPA has set the action level for radon at 4 picocuries per liter. If the results are 4 picocuries per liter or higher, take action. Contact your state radon office to get the name of a local expert who can give advice. You can fix some problems. You can fix some radon problems with simple to low or no cost solutions. For bigger radon problems, you need a specialist called a mitigation contractor to fix your home. But again, the benefits outweigh the costs. And if I had recommended my grandmother did this, she doesn't live in the US, that could have possibly saved her life and she may not have gotten diagnosed. So this is another big risk. And even if you don't smoke, it can affect any of us. Another question we often get is how vaping and e-cigarettes affect the lung cancer risk. Vaping and e-cigarettes are relatively new phenomena and have become more prevalent in the last decade. While the long-term effects of vaping and e-cigarettes are still being studied, it is clear that for individuals who have never smoked before, they can increase their risk of lung cancer. E-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. These arise both as elements of the e-liquid and as a result of organic reactions in the electronic cigarette device. Various studies demonstrate in vitro transforming and cytotoxic activity of these derivatives. Vaping causes fewer health risks than smoking, yes, but it's not a risk-free activity. Vaping can increase heart rate, decrease air volume in lungs, and increased airway resistance. Furthermore, e-cigarette device has been significantly increasing, so the use has been increasing, particularly among young adults and non-smokers who think that it's an alternative to smoking, which makes it a significant area of concern for the future. It is not an alternative. Additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not a substitute for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is the best way to detect lung cancer early. Using both is the most optimal strategy to fight the disease. For every year that an individual quits smoking, their risk for lung cancer is reduced by 8% to 17%, depending on the kind of lung cancer that they have. Another reason that smoking cessation is important is because it is required by Medicare and Medicaid services for lung cancer screening programs. However, we do not understand that smoking cessation can be difficult. There are a lot of resources for people to trying to quit smoking. Some great programs are the Renowned Health and Wellness Quit Smoking Program and the Nevada Center Coalition's Quit Smoking Program. As this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase lung cancer screening rate. Lung cancer is the deadliest cancer in the world, and while lung cancer screening can save so many lives, very few high-risk individuals are currently getting screened. We are working to address all aspects of this issue. Last fall, ALSI worked with the U.S. Congress members and senators to draft and advocate for the first ever House and Senate resolutions to detect U.S. House and Senate resolutions recognizing the importance of early detection of lung cancer through screening. In December 2020, the Senate resolution was passed with unanimous consent, marking the first time the U.S. Senate has ever recognized the importance of screening. ALSI has also actively been working with Representative Brendan Boyle and Senator Tina Smith to draft and advocate for Catherine's Law for Lung Cancer Early Detection and Survival Act of 2021. And these are a little bit outdated in terms of when we're talking about these dates. But additionally, we have been giving lots of webinars, such as this one, to educate a variety of audiences about lung cancer screening, including students, community members, healthcare providers, community leaders, and policymakers. We believe that educating communities, especially students, about lung cancer and lung cancer screening is crucial to lowering the number of deaths associated with the disease. Students greatly impact and influence the healthcare of their patients, and we hope that by educating students about important measures that can be taken, we will not only be able to help the students, but also their family members. If you know anybody who might be eligible for lung cancer screening based on the criteria listed on the previous, not on this slide, but on the previous slide in this presentation, which we can share later, please share the link given by the QR codes so that they can contact one of our doctors about lung cancer screening. Again, this is the phone number 650-736-5864, which you can schedule a virtual pre-screening. Lastly, we have a short 5 to 10 minute questionnaire to better understand how much people know about lung cancer when compared to other cancers and determine how many people meet the lung cancer screening guidelines. If you are willing to take this questionnaire, you can access it through the QR code or link pasted in the chat. And I'm going to send that link in just a minute. We really appreciate your participation because it will help inform our outreach and advocacy efforts going forward. Thank you for all of your time today. Now I would like to open the floor to any questions you may have. We welcome any and all questions. And yeah, thank you so much. And I'm going to send that screening link in the chat in just a second.
Any questions? Well, there's a statement. The late Susan Wojcicki. How can she treat it? That's what it says. That's the YouTube CEO.
I'm sorry. Can you repeat that one more time?
The late Susan Wojcicki. How can she treat her cancer? I assume.
Susan Wojcicki. How can she treat her cancer?
Hmm.
I don't think. Well, I'm a big. She was CEO of YouTube. How can she treat it? Well, I'm not sure the specifics of her case. I'm not a doctor. I can't predict how we could have saved a cancer of somebody who already passed away. I'm assuming if she had gotten tested earlier, that could have may have reduced her risk. Um, because obviously it's the mortality is higher when it's caught at a later stage. But we can't make retroactive, observations about people who've already passed away. I see another question in the chat. How do we know about radon? The thing is, you might not know about it, which is why you should buy the radon testing kit and see what the radon levels in your home are. Um, it is the most common, risk of lung cancer besides smoking, and results in, the majority of, not the majority, but the plurality of non-smoking lung cancer diagnoses. So you should get the radon testing kit for $10 to $30. Test your home to see what the radon levels are, and then if they're above that certain threshold, contact somebody to help lower it.
Well, thank you so much. We appreciate the education.
Yep. Thank you so much for having me.
Thank you. Take care. Bye bye.
Bye.